Guys, today we're going to be solving a high-yield respiratory USMLE Step 1 question. The respiratory system on the USMLE Step 1 is one of the highest yield topics. Understanding its physiology, pathophysiology of the respiratory system is super essential for passing the USMLE Step 1 exam. So in this question vignette, we essentially have a 47-year-old man. He comes to the emergency department with a sudden onset of shortness of breath. That developed shortly after returning from a long distance business trip. Now over here we are immediately getting the clues of that he has had a long business trip. So we are seeing that he's having a lot of stasis because he's not been in on a long trip. His blood, all the coagulation products, they've accumulated. A lot. In addition to that, a lot of the platelets would have accumulated, so he's in a thrombotic state. In addition to that, he's in a state of shortness of breath in an acute scenario. So immediately we're thinking about cardiac causes and lung causes of shortness of breath. He has a history of hypertension. He smokes 1 pack of cigarettes per day. Immediately we're getting 2 more risk factors for thrombosis. Because of hypertension and cigarette smoking, we're getting damage to your endothelial cells. When we get damage to our endothelial cells, essentially we are getting release of Brady-1 factor, and we're getting release of subendothelial collagen. This leads to attracts platelets, and this leads to essentially thrombosis of the artery. Further reading on, his pulse is 110. Immediately looking at the pulse being 110, we're thinking about hypoxia. Hypoxia triggers the peripheral chemoreceptors, which then leads to a sympathetic nervous response, which leads to a high amount of high heart rate and compensatory vasoconstriction. In addition to that, because we are thinking about some embolism, pulmonary embolism over here, we're getting decreased blood to left heart. The blood is going to then compensate by increasing the heart rate. His blood pressure is 148/89. Physical exam reveals clear bilateral breath sounds. Laboratory results show an elevated D dimer. Okay, so an elevated D dimer is essentially we are thinking about embolism, pulmonary embolism over here. Now, because of pulmonary embolism, we're going to be getting breakdown of this clot. This breakdown of this clot will be leading to fibrin degradation products, which is known as D dimers. So we are immediately thinking about some embolism, some clot, such as pulmonary embolism. Which of the following best describes the ventilation-perfusion ratio for affected region in the patient's lung? So we can see increased ventilation and decreased perfusion, increased ventilation-perfusion ratio. So over here, increased ventilation, we're not really thinking about increased ventilation over here. Because over here, as we said, we're thinking about diagnosis of pulmonary embolism. If we draw alveolar sac over here and we draw an artery over here, we're thinking about obstructive causes to the artery. I think over here what happens is alveolar sac is completely normal. So that's completely fine over here. So we can easily eliminate this answer over here. Decreased ventilation, increased perfusion, decreased ventilation-perfusion ratio. Again, guys, this is completely wrong because decreased ventilation, over here the alveolar sac is completely fine. His ventilation is normal. There's not a decrease, there's not an increase over here. Perfusion being increased, no, that's completely wrong. If anything, his perfusion is being decreased because he's getting obstruction to this artery. Normal ventilation, decreased perfusion. Now that sounds interesting because look at his ventilation over here, it's completely normal. He's having decreased perfusion, so his ventilation perfusion ratio is as a result increasing. So that looks like a correct answer. Choice number D, normal ventilation. Yes, he's having normal ventilation. Increased perfusion, that's incorrect because as we can see over here, he is having decreased perfusion. So this makes it incorrect over here. The last option over here, decreased ventilation. No, his ventilation is completely normal. Nothing's happening to his alveolar sac. He's like a normal person. Normal perfusion, that's incorrect because he's having obstruction his outer artery. So decreased ventilation perfusion. So guys, overall we can see over here that he is essentially, the C is going to be our correct answer. In addition to that, guys, what is the concept over here? We're getting a thing called dead space. We can see ventilation over here is completely normal. His ventilation over here is completely normal. And if we draw perfusion over here, his perfusion is getting decreased. So now his ventilation-perfusion ratio is going to be increased. So if we were to write his ventilation-perfusion ratio, it would be equal to infinity. And this is essentially a concept called dead space. Now for the purpose of USMLE, we want to know that dead space will equal to pulmonary embolism. Dead space and pulmonary embolism are going to be the same thing on the USMLE. So this was overall a quick question for the USMLE Step 1. on pulmonary embolism. Hopefully you found this video useful. Thank you for watching. Hope to see you guys next time.